Hey guys, Dr. Ray Marque here, your local chiropractor at Back Pain Relief Center. This is another edition or episode of Dr. Ray TV, and these episodes are designed to start giving some people in the community some feedback on the different types of cases that I see and the different disorders or pain disorders that people are being affected by and that I can help with. There's a lot of things out there that can help people with it. Sometimes they don't realize that a chiropractor can do. So today our subject is knee pain. And I think I'm a little crooked here. Is that better? Maybe. Well, anyway, today we're talking about knee pain. Now look, I'm a chiropractor. My specialty is biomechanical dysfunction. I do specialize in the spine. Majority of my patients are low back, but I see an awful lot of knee pain patients. Many of them that I can't help, and there's many that I can. But I know I can do a pretty good job at least diagnosing what the problem is and getting you on your way. So let's talk about a couple of things and how I kind of get involved in the whole thing. Number one, there's many causes of knee pain. We can have a simple wear and tear arthritic type of problem where you've just been hard on yourself through the years and you got some arthritis in your knee and it hurts. We have some more complicated problems like torn meniscus, torn ACLs, PCLs, medial collaterals or lateral collaterals. So the ligaments that add stability to the knee can get torn. And one of the reasons I do see a lot is because I'm involved in jiu-jitsu and judo, and I see a lot of those guys, and it seems like always at some point someone has a knee injury. So I am a little familiar with it. So first things first, if you have knee pain, the thing to do is not to ignore it, figure out what's going on. And then once you know what's going on, maybe you can ignore it. And what do I mean by that? So we have all these stabilizing ligaments. If one of those are torn, then that's not the time to ignore it, okay? Because it leaves the joint at a bigger biomechanical dysfunction, meaning you have the opportunity to injure it even more. So if you have a major ligament torn, there's some gapping, there's instability in that knee, that's something that's going to be a direct referral to the orthopedics and let them fix you up. Now, when can we avoid maybe ignoring it? Well, if it's our arthritic disorder, so just some degenerative joint disease or degenerative knee disease where you have some bone spurs, some arthritis, some inflammation, that's where I can come in to help. And we can do that by using some cold laser that's been very, very effective on knees. Cold laser therapy helps with a lot of things when it comes to knees, especially reducing pain. We can do some physiotherapy, some electric stim. We can do some ice. We can do some manual therapy or some muscle therapy on the quads, the hamstrings, on the calves, on all the supporting muscles in order to relieve pressure on it. Maybe we can give you a knee brace that can decompress the joint and make you feel better. So I guess that pushes right back to the fact that we need to figure out what's going on. So if you come in our office, what I'm going to do is do an exam, figure out what the problem is, take some x-rays, or even possibly send you for an MRI. An MRI really is going to tell us everything. And I jump a little faster than a lot of doctors to send for MRIs because I believe if we just cut right to the chase, we can figure out exactly what the problem is and then we go from there. Because an MRI is going to show me the ligaments, the muscles, the joints, the fluid, the whole deal, the bones, and we'll see what's going on. Whereas an x-ray will just kind of show me if you have an arthritic disorder or a deviation and misalignment in the joint. So again, that points me right back to correct diagnosis. So say I send you for an MRI and we don't see any tears. So there's no tears in the major stabilizing ligaments. Then we'll go over some options on how I can help, again, using cold therapy, manual therapy, soft tissue mobilization, wearing a knee brace to decompress a joint, or even possibly sending to physical therapy if I think it's something out of my hands. Here's a big thing that a lot of people get, even one that I just had to deal with a minute ago or a few months ago. Torn meniscus, okay, and you hear everyone getting. So the meniscus is kind of like a pad in between the two bones in your knee, at the top and bottom, and it acts like kind of a cushion or a barrier between the two bones. And it seems like that's what everybody tears. So I tore my medial meniscus, I guess a year or two ago, and I put it off for like 2 years, or the year or two it was, And finally, it was stopping me from doing the things like I enjoyed, like running and going to judo, and I was having difficulty sleeping, so I knew it was time to get to the orthopedic and get surgery for it. But that's not everybody. Everyone doesn't have to have that surgery for the meniscus. A lot of times we can use cold laser, manual therapy, soft tissue mobilization, even adjusting the lumbar spine and pelvis in order to relieve pressure on there, and sometimes you can put that off for a while. So we don't always necessarily need to have that surgery right away, because it seems like as soon as they do surgery on that knee and they disrupt that capsule around the knee, it never seems to be the same. And that's just personal experience with mine. It's much better, and I think they did a great job at what they said they were going to do, but I think it's just never the same. Where at me on my notes here. Okay. When should you do something about it? Okay, so when should you call me, or when should you come in, or when should you go to an orthopedic? You know, a couple things. That relies on your pain levels. You know, some people have a very low pain threshold, and if it bothers you a lot and it's stopping you from doing the things you want to do. So, for example, you can't play with your kids, you can't go out and play softball, you can't go to the gym, or you're having difficulty sleeping, then it's time to do something about it. If all of that stuff's fine and you can put up with it, then just put up with it. But when you get to that point where it's stopping you from doing something, get in to see me. Let's diagnose the problem. Let's find out if you need to go to an orthopedic or not. And you may be saying, well, why should I go to you since you don't specialize in knees? And maybe I should just go right to the orthopedic. Well, number one, you can go right to the orthopedic, and I don't think that's a bad decision when it comes to knees. But what I can do is maybe save you some time. You know, if you come to me, let me find out what the problem is. If you don't have a tear or something that I know they're going to be able to fix, we can just start your therapy right here, save you a little bit of time to running around at a bunch of different places. What are some alternate therapies? So I have some people come in and we figure out it's a torn meniscus, there's nothing major going on, and they just don't have time for the therapy. Well, that's okay. So what we tell them, you know, then I'll refer them back to either their general practitioner or their primary, urgent care, or to orthopedic. And what I've seen in the past is a lot of times they'll give you a cortisone injection in the knee. And there's a bunch of different things they do in the knees here on out. And I'm not fully up with it, but they'll give you some type of injection, whatever they think is appropriate. And you know, if that makes you feel better for 6 months, then that's great. Feel better for 6 months. I'm all for it. Sometimes they can give you some oral medication. There's a bunch of different things that they'll give. And maybe that's enough. And that's all good. If that's enough to get you back on track and get you doing the things that you like to do, then that's good. The one thing I don't like to see is if you're limping around or if you're favoring the other side. And if your leg hurts so much that you kind of got to use a cane, or you got to push up to use your arm to get up on one side. When we start having biomechanical alterations or dysfunctions, a bad knee can shift to your hip, and it can shift to your low back in a minute, and your back can hurt and begin to cause or start a degenerative process there. I know this firsthand because when I had my recovery, actually the pain before and the recovery after, I was limping around on my knee, and my back was killing me the whole time. So the quicker we address the knee problem, the less problems you'll have in the future. The less adhesive buildup you'll build up in the joints, the less complicating factors that will happen. All right, so again, knee pain is not my specialty, but I do see quite a bit of it. If you'd like to just message me and talk about it, I can give you some good advice and see where you're at from there. If I can help, I'll absolutely invite you in. If I can't, I'll get you to the right people. I think that's it for today. Hopefully that helps someone out there that's suffering from some knee pain. I do carry a full line of knee braces and different things that you can use at home that would help. So if you'd like something, just shoot me a message and we'll talk about it. Any future topics, please let me know. I'm going to be doing these things Monday through Friday. I'd love to hear what people are interested in. All right, I hope that helps someone out here. Today's Monday. All right, I'm all messed up because of that Pats win last night. So today's Monday, and everyone have a great day, and we'll talk to you soon. Bye-bye.